So good afternoon, everybody. My name is Damian Sewick. I'm a project manager for Region 5 for Kids Pediatric Disaster Center of Excellence. And welcome to our showcase today where we will demonstrate and share a cybersecurity toolkit for healthcare coalitions. And with that, I'd invite Dr. Ruffing to for some welcoming comments.
Damian, thanks so much. And I want to thank everybody for joining us today. What we have tried to put together here is a presentation about a toolkit, a template to help healthcare coalitions meet their HPP obligations related to cybersecurity. We have presented some of this information before. It was very well received, and healthcare coalitions really felt it helped to move them forward in this work. So we have come together today to present this information again, to share with you our template and help you to fulfill your obligations around preparing for cybersecurity events within your region. So thanks so much for joining us. And we hope that you find this meaningful and helpful in your work. Next slide. As Damian mentioned, I and himself and a large number of other people are part of the Region 5 for Kids Center of Pediatric Excellence. We work primarily in the upper Midwest, states including Illinois, Indiana, Michigan, Ohio, Wisconsin, and Minnesota. However, because of the nature of the work that we do, we really think that this particular remembering about the special needs of kids is important to everyone. We focus our attention on some particular problems in our region, but we know that this is universal. So that's one of the reasons why we wanted to share this information with you today. Go ahead.
Thank you, Dr. Ruffing. And just a little bit of webinar etiquette. For those, to remind folks, the webinar is being recorded. The question and answer feature of the webinar is the preferred form to ask questions. When we are done presenting the full toolkit, there will be a period for question and answers. All attendees should be able to view other questions posed by other folks. And if you have one that's of particular interest to you, you should have the opportunity to, or the capability to upvote or second that question so it sort of goes to the top of the list. Throughout this presentation, there will be several QR codes provided. So if you're interested in accessing and following along with the document and downloading it during the showcase, have a QR capable device available. And with that, as Dr. Ruffing mentioned, of course, we are Region 5 for Kids. We are an ASPR-funded grant entity. So the traditional disclaimer, everything we present is of Region 5 for Kids. Nothing we present represents the official opinion or policy of ASPR, Health and Human Services, or the federal government. So here's the first QR code for the group. If you're interested in opening the full toolkit and following along as we go through the demonstration in the showcase, this QR code will open a Region 5 for Kids webpage. And if you scroll to the bottom of that webpage, there will be a section, and I can't see because it's pop-up. There will be a section titled Implementing Cybersecurity Programs. The cybersecurity planning documents, if you open that up, there's 4 Word file attachments in there that you can download. The 4 files are, of course, the third one down, the full cybersecurity toolkit. And baked into that toolkit, there are 3 additional templates that we present and offer individually if you're just interested in one of the templates. Of course, one being a cybersecurity exercise plan template, a cybersecurity assessment template, and the 4th option there is cyber support plan template. And so, once again, the QR code will take you to a Region 5 for Kids webpage. Towards the bottom of the webpage, these documents are all available. The one we're going to work with today will be the full cybersecurity toolkit. And a recent edit to our webpage, you can actually find that full toolkit much closer to the top underneath the information for this particular showcase as well. And with that, a little bit of I'm going to link around this page for folks who catch up in QR code and download. And just a little bit of background. This particular toolkit was designed to meet the intersection of what a healthcare coalition, from their point of view, and how it operates. A second factor is, of course, cybersecurity and all those implications. And the third factor that went into sort of crafting and scoping out the toolkit was, of course, the ASPR Hospital Preparedness Program Cooperative Agreement requirements for cybersecurity. All of that to combine, in theory, we have a tool that should be useful for a healthcare coalition coordinator to meet the ASPR requirements for cybersecurity as laid out in the cooperative agreement. And hopefully by now, everybody who's interested has access to the toolkit. We will begin looking at that in just a few slides. We gave our
Sorry, just for reference, I wanted to let everybody know that I uploaded the link into the Q&A if they were not able to get there via the QR code.
Perfect, thank you. We gave our previous traditional grant disclaimer. We also want to make sure folks understand that this particular toolkit has not been reviewed or endorsed by ASPR. We believe it meets all the requirements. Our local healthcare coalitions were excited and of the similar opinion. However, push comes to shove, it is not official ASPR approved toolkit. And so with that, our first look at the toolkit. Of course, there's an image on the left-hand side of the screen. We present the table of contents and just a little bit of information. The full toolkit in total is 55 pages. As I mentioned before, it does contain the 3 individual templates as related to that ASPR Cybersecurity Cooperative Agreement requirements, with the first one being a template for a cybersecurity assessment. The second template incorporated into the full toolkit would be a template for cybersecurity support planning, and of course, a third one for a cybersecurity tabletop exercise. Baked into the full toolkit, but not necessarily the individual templates, we do provide 6 additional appendices with information from various organizations as it relates to those organizations' cybersecurity programs. You can follow along Appendix A through F. Of course, we highlight and use the Health and Human Services cybersecurity program. We really use that as a bit of a North Star for composing the entire toolkit. Just sort of that chain of command thought process. HHS over ASPR, let's meet HHS requirements. Therefore, we will meet ASPR requirements as well. So we provide those as Appendix A, and we will see that in a few minutes here. We also, in Appendix B, provide a link to ASPR's cybersecurity program. Appendix C, we link to the components, the cybersecurity components of the ASPR Cooperative Agreement, provide that language in the toolkit. Appendix D, not presented here, but Appendix D is 7 individual CISA cybersecurity tools and resources. Now, anybody who's familiar with CISA know they have thousands. We've collected and presenting what we feel are the 7 most important as related to healthcare and public sector agencies. Appendix E, we provide a link to a FBI resource that they recommend after an attack, after some sort of cybersecurity incident. That's the way you would engage the FBI to help respond. And then, of course, your traditional terms and acronyms in Appendix F. And with that, bear with me for a minute here as I transition between a PowerPoint presentation and the actual toolkit. Where's it at? There we go. And Sherry or Dr. Ruffing, is this presenting well?
Yes.
Okay, perfect. Thank you. And so for the folks online, of course, this is the cybersecurity toolkit that Region 5 for Kids has composed. And we've already shared it with the healthcare coalitions in our 6 states. Of course, we think it has value and we want to make it available to healthcare coalitions nationwide. We've crafted this toolkit with the thought of having a sort of universal, a bit generic toolkit that is user-friendly in a Word format that is easily edited by a healthcare coalition to meet their local needs. The document is provided in a Word format that have edit, change, delete, whatever your local healthcare coalition might need. So before I take the walk down the actual toolkit itself, I'm going to scroll to one infographic and explain how it represents or impacts the full toolkit. If I can okay, bear with me. I apologize. My mouse pointer is not working in Zoom mode. Let's try this. So this particular infographic, it is an infographic that we collected from the Health and Human Services Cybersecurity Program. And it sort of represents the outline or the HHS approach to cybersecurity. As mentioned, we used the HHS cybersecurity program as a bit of a North Star while crafting this particular toolkit. You can see they list 20 goals in support of the cybersecurity program, with the ones on the left-hand side being essential goals and the ones on the right-hand side being sort of enhanced goals, additional, potentially auxiliary goals. These essential goals and enhanced goals are what we use to sort of craft and outline the first template of a cybersecurity assessment. So you will see this pattern of goals replicated in both the assessment toolkit and a little bit into the planning toolkit as well. I would point out that the very first goal, mitigate known vulnerabilities. We're going to come back and look at that in just a few minutes here. But once again, a cybersecurity toolkit, universal, user-friendly Word document for editing by local healthcare coalitions. Of course, that first paragraph there just sort of recognizes that in the federal landscape of cybersecurity, with CISA, the FBI, Health and Human Services, ASPR, there are many, many resources available. However, for the intersection of healthcare coalitions, cybersecurity, and those ASPR cooperative agreement requirements, we distilled all of those sort of resources and attempted to narrow it down and embed in the toolkit the resources most appropriate from that healthcare coalition perspective. We looked at the table of contents in my last slide in the PowerPoint presentation. I would just note that in Appendix D is those 7 additional CISA resources and tools that would absolutely help out a healthcare coalition develop a strong cybersecurity program. And we are looking right now at the full toolkit. So this is the full 55-page document. I think I've discussed the purpose of the toolkit several times now. But once again, the idea is really just to try to distill the vast landscape of cybersecurity information, craft a toolkit useful and editable by a healthcare coalition that would meet the requirements of that ASPR cooperative agreement. That second paragraph, selective content, is what I hinted at before. Out of that full landscape of cybersecurity resources and materials, we distilled and coned it down to what would be most appropriate for a healthcare coalition and the development of a cybersecurity program. As I'm sure you understand, cybersecurity is an ever-changing landscape. What is true today may not be true in 6 months from now. This toolkit was crafted in April of 2025. All the data and information and policies cited are dated from April of 2025. 5 years from now, we would not recommend using this toolkit unless you go back and validate and verify each of the sources of information used to compose the toolkit. But as of April 2025, this was sort of the state of the art for healthcare coalition cybersecurity programs. And of course, the funding statement, we've gone over that twice already. So what we're presenting here is the first template within the full toolkit, the template for a healthcare coalition to conduct a cybersecurity assessment. I mentioned before that we relied heavily on the Health and Human Services essential goals for cybersecurity programs. That number one being mitigate known vulnerabilities. I'm just recalling that to remind folks that this full assessment is based upon the Health and Human Services full cybersecurity program. Of course, the goal of the assessment is to complete an assessment which meets the needs of the ASPR Cooperative Agreement. 2 standards, Health and Human Services Cybersecurity Program, specifically cybersecurity performance goals, as well as that ASPR Cooperative Agreement. The use is designed, the form, and once again, this is completely editable by a healthcare coalition to add, delete, add text. It's designed to be completed by a healthcare coalition during we conceived either a Zoom video conference or maybe a half-day workshop where you invite members of your healthcare coalition to have this discussion and conversation. It is set up to fill during a meeting, during an actual conversation or discussion to conduct the assessment as required by ASPR. Of course, just some admin data, your healthcare coalition, your date, a little bit of description, and who is in attendance. And then getting into sort of the cybersecurity assessment of your healthcare coalition jurisdiction. That first paragraph just highlights that the 10 essential goals and enhanced goals come out of the Health and Human Services cybersecurity performance goals, which we've mentioned before. And I want to drill down on this point a little bit with the Health and Human Services cybersecurity program. I showed you the one infographic to really highlight the enhanced goals. Their program is much greater and deeper than just that one infographic. In their resources, they do drill down and pull apart each of these goals so that they provide a description, they provide expectations, they provide mitigation strategies for organizations that might not meet one of those particular goals.
Excuse me, Damien.
Sherry?
There's a question from in the chat just regarding how this is different from the Healthcare Coalition Cybersecurity Assessment released by Asper Tracy. Do you want to answer that now, or do you want to wait until the end?
The end.
Okay.
Thank you. And so what we're trying to sort of present here or describe here is the outline and the construct of this particular assessment. For each of the 10 essential goals, as mentioned, the Health and Human Services program peels back the onions and provides the descriptions and mitigation strategies for each. From that Health and Human Services description, we composed a question to sort of ask an audience. which in this case would be, do organizations of healthcare coalitions work to reduce the likelihood of threat actors exploiting known vulnerabilities? Ideally, prompting a small discussion within your healthcare coalition to sort of get a general from their perspective, yes or no, they engage in those activities. There's a small space for 4 lines to record those significant comments or those aha moments that often present themselves during a discussion. Further on down, there's the question from the healthcare coalition perspective. Is this particular vulnerability, is it a gap from the healthcare coalition perspective for the healthcare coalition writ large? As an example, if you have 100 organizations in your conversation, but one organization is failing to meet this goal, then your whole healthcare coalition isn't necessarily, this isn't a gap for your full healthcare coalition. In contrast, if 80 of your organizations have a problem, you would select yes, that this is a potential gap for your healthcare coalition. And then immediately, if needed, select one of the 3 mitigating strategies as provided out of the Health and Human Services Cybersecurity Program. So this template, this assessment template, is really designed to facilitate a conversation from an audience of your healthcare coalition partners to address each one of those 10 essential cybersecurity goals. Ask a question, get their opinion about it, their assessment, record any significant points, make the determination from your healthcare coalition, is this a gap for the coalition writ large? And then, of course, if yes, select one of the mitigation strategies. And this pattern of ask a question, conversation, make notes of significant discussion points, make that healthcare coalition perspective assessment, and identify mitigating, selecting mitigation strategies to address potential gaps. It's repeated for each of those 10 essential goals of the Health and Human Services Cybersecurity Program. So with that, I'm going to sort of scroll through the 9 remaining goals, and you will see this pattern replicated. Question, yes or no. Comments, healthcare coalition, is it a gap, yes or no? And then potential mitigating strategies. The mitigating strategies will vary based upon which particular goal it is, because of course, different mitigation strategies used to address different cybersecurity gaps. So of course, from that previous infographic, the second one was of course email security, multi-factor authentication, base cybersecurity training, a strong encryption, a revocation of credentials, basic incident planning and preparedness, unique credentials, separate user and privileged accounts, and then of course, vendor and supplier cybersecurity requirements. And we still see that pattern replicated. A question, conversation from your partner's perspective. Are they doing these activities? Record any significant observations from the healthcare coalition perspective. Is this a gap? And then a potential mitigation strategy. And so that's the first half of the assessment. If you recall on the infographic, Health and Human Services also has 10 what they consider enhanced goals. The one variable in the enhanced goals versus the essential goals is in the Health and Human Services program. They do not necessarily specify mitigation strategies for each one of the enhanced goals. So you'll see a very similar pattern of asking the question, conversation, recording notes, and then from a healthcare coalition perspective, making that assessment. Is this a gap, cybersecurity gap writ large for your audience? And then once again, all 10 enhanced goals are presented in that same repetitive format. And that is the 15 pages of the cybersecurity assessment. I'm sorry, there's two more components I forgot to mention. As per the cooperative agreement, ASPR requires the assessment to include to describe community impact. And basically these two questions is to provide a brief description of communities within your healthcare coalition's area that are most impacted by a disaster, and then just consider how the most susceptible communities within your jurisdiction would be impacted by a cybersecurity incident, and provide a brief description of that. Those are the 15 pages of the cybersecurity assessment, first template baked into the overarching cybersecurity toolkit. And with that, take a deep breath and change our mind a little bit. And we're going to start to present to you the cybersecurity support plan. A little bit of background on this template within the toolkit. This one is 8 pages long. Once again, it is crafted in a Word document, intended to be user-friendly, sort of that universal approach. Everything within this section that is highlighted yellow, there would be a bit of an onus on the Healthcare Coalition to edit, as in put your Healthcare Coalition name in there, or maybe place a logo onto the plan template itself. This particular template was crafted by using an existing template for one of our partner healthcare coalitions. It was crafted and designed that in such a way that ideally, in a perfect world, once completed, it would fit nicely as an annex within your healthcare coalition's larger plan. Recognizing every healthcare coalition plan's different, but that sort of universal general approach, this might be a good solution for the full audience. Areas highlighted in yellow, once again, to be changed. The planning support plan template, once again, completely editable. Anything could be added or deleted as needed by a healthcare coalition. So, of course, we start off with a bit of a traditional cover page, a title, if you're interested in placing your organization's logo there, a blank page by design, and then the body of the cybersecurity support plan. We can see through the table of contents, there's a bit of an introduction with the purpose and the scope of the plan. Then we get into the concept of operations, additional considerations, and we baked in the thought of one appendix for the support plan. I want to circle back to that concept of operations and recognize that the evaluate would be the activity that occurred in the cybersecurity assessment of the previous template. The prioritization, a little bit of additional work to the gaps identified in that previous template, the assessment, sort of prioritize that, and we will look at that in a minute. Then, of course, plan to address those high impact activities. And so that's sort of the overarching layout of the 8 pages of the cybersecurity support plan template. Hopefully the format is familiar to the full audience. As mentioned, we base it upon the planning template of one of our local healthcare coalitions. Of course, we provided purpose, all of the yellow areas where a healthcare coalition would insert their designation, a scope of the plan, an overview and background of the local healthcare coalition's situation, i.e. a description of the geographical location, states, county, municipalities, and whatnot. Potentially identify members of your healthcare coalition, if not identified elsewhere within your larger healthcare coalition plan. A few planning assumptions, and then into sort of the concept of support operations. As mentioned a minute ago, this evaluation, that would just be sort of collecting the information from the previous template, that assessment, and populating a few comments here. At the healthcare coalition level, identifying, recognizing those gaps, evaluating those gaps against the measures of high impact, broadest impact, access to cybersecurity resources and existing resources to identify which gaps have the highest impact within your healthcare coalition. So we evaluated the plan. It takes you through a bit of a prioritization and then presents the plan to address the highest impact activities. This is sort of where the universal aspect of this template handicaps the template a little bit. We can't drill down and provide a specific solution to every cybersecurity gap of all healthcare coalitions. So what we've presented here is just a handful of potential options to address various gaps identified at the local healthcare coalition. Of course, in section C there. And then any additional considerations. This situational awareness could be a practice adopted by a healthcare coalition. That link would take you to CISA's cybersecurity alerts and advisories, basically a reoccurring newsletter where they put out the latest and greatest threats and solutions. A healthcare coalition to sustain situational awareness or achieve situational awareness could simply just sign up for that, join the listserv for that particular reoccurring announcement. And of course, communications. And I mentioned the one appendix potentially within the template for the cybersecurity support plan would be the full assessment. That first template, the full assessment, that was conducted as the first step of developing a cybersecurity program. I hope that made sense. Sherry, Dr. Reffing, am I okay?
You are not frozen. You are good.
Thank you. So those were the 8 pages of a template for a cybersecurity support plan that a potential healthcare coalition could use and modify for their local use. And once again, crafted to meet those cybersecurity requirements out of the ASPR current cooperative agreement. Which takes us to the third and final component of the toolkit, a template for a cybersecurity tabletop exercise. This particular template, it's 13 pages long. For those familiar with conducting, planning exercises, this template should be very familiar to you. It is written in the FEMA HC program standard. Once again, the standard that was in effect last April. What's similar to the support planning template, all the items highlighted in yellow, clearly there would be an opportunity for the healthcare coalition to input their organization's name and or designation. As with the previous 2 templates, as with the entire toolkit, everything is in a Word file, easily to edit, add, delete, place in logos and whatnot for the local healthcare coalition. So for the cybersecurity tabletop template, a bit of one more sort of comment about tabletop templates. Similar to the large volume of cybersecurity materials that's available across the federal government, there are quite a few tabletop templates that are available across the government. CISA has them, FEMA has them, ASPR has them, they're available. We think this particular one is a little bit different because we focused once again on that intersection of a healthcare coalition, cybersecurity, and those ASPR requirements for the cooperative agreement to sort of hone and narrow down and hopefully focus in this particular template for that intersection of interests. This template will probably be a lot more quicker because folks will be familiar with it. Of course, an exercise plan updated for your date, the exercise overview, once again, completely subject to being edited by the local healthcare coalition for the date and the scope. That that fourth block there, the National Institute of Standards and Technology Cybersecurity Framework Functions within the federal government writ large. That is the document that sort of establishes cybersecurity standards, policies, practices. CISA, Health and Human Services, ASPR, FEMA, all subject to that particular policy. So we included that in the exercise description. The Health and Human Services cybersecurity performance goals, we should recognize those. So they're the same exact 10 that we began the discussion with. Of course, mitigate known value vulnerabilities is the one I called out at the very beginning of the discussion. Propose some exercise objectives. Once again, Healthcare Coalition has different ideas, easy to edit. And the rest of the components of the exercise description. We did include and break in one additional paragraph into the exercise plan, that building resilience. In our engagement of CISA and their team of experts, they really had a theme of resilience, cybersecurity resilience, that they really hung their hat on to honor and respect that sort of approach. We, of course, added in sort of a paragraph describing that and incorporating that idea into the tabletop exercise in and of itself. And the rest of this should be fairly familiar with folks with a background in exercise planning, exercise objectives, and core capabilities. What we're presenting here is a crosswalk between those objectives we saw in the description and those 8 Health and Human Services cybersecurity performance goals, those 10, sort of the crosswalk between the objectives and those 10 HHS goals. Traditional verbiage for participant roles and responsibilities, structure, guidelines, assumptions, and artificialities. Traditional verbiage in an exercise plan for logistics, fire safety, emergency medical services, post-exercise evaluation and activities. Traditional language as far as participation, information, and guidance. Appendix A proposed agenda and timeline for a tabletop exercise. Once again, easy to edit by the local healthcare coalition to meet their local needs. Appendix B of the exercise plan template, of course, you record the participants. We always like to provide the standard that the exercise is working towards. So, of course, here is those Health and Human Services cybersecurity performance goals. And a final appendix of the tabletop exercise planning template, of course, the traditional acronyms. Once again, all crafted in that FEMA HC planning, exercise planning format. And with that, we have introduced the full toolkit, taken through 3 separate templates baked into the toolkit, a template for an assessment, a template for a cybersecurity support plan, and a template for a cybersecurity tabletop exercise. And I'm just pausing here to recognize that Appendix D is Appendix D of that 3rd template, but Appendix A of the toolkit writ large is circling back and providing all those resource materials. A link to Health and Human Services cybersecurity program. And all of these links are active in the toolkit. Circle back and provide a link to those key essential goals of cybersecurity, as well as the enhanced. Appendix B, the ASPR cybersecurity program, a link to that information as applicable in April of 2025. We just called out the specific language of the ASPR cooperative agreement as related to cybersecurity. Once again, recognizing this was written April 2025. That deadline of June 30th, we recognize BP2 guidance changes that deadline. However, this was written in April 2025. For the cybersecurity assessment, same thing with the deadline. And then, of course, for the cybersecurity exercise, just providing that language from the cooperative agreement as it relates to cybersecurity. These are those 7 resources and materials from CISA that we felt were most applicable to a healthcare coalition's successful cybersecurity program. And there is a link on each one of these pages directly to each one of these resources. I will throw a caveat in there. Once again, this is as of April 2025, with recent changes occurring at the federal level. Double check all of those CISA resources before implementing fully. Appendix E, and we did partner with our local FBI cybersecurity expert to get his input, with the idea that FBI is who an agency would engage after some sort of cybersecurity incident. Their main message was the IC3, the Internet Crime Complaint Center. His theme of his hour-long presentation was call us fast, call us first, submit a complaint through this form. And then from there, FBI will unroll their response to some sort of incident. For the toolkit, terms baked into the toolkit, and of course, acronyms baked into the toolkit. And with that, once again, so a 55-page toolkit designed to support healthcare coalitions meet the cybersecurity requirements of the current ASPR cooperative agreement. Please bear with me as I stop screen sharing the toolkit and switch back to a presentation. And Sherry, we will begin the
question and answer.
Q&A in just a second here.
Okay.
Okay. So let me do this. Okay. Well, here we go. So, and is this presenting well?
It just is the Q&A slide.
Perfect. Thank you.
You're welcome.
Can I see the Q&A?
There are a couple of specific questions, Damien. One is from Nicholas, just in terms of how the Healthcare Coalition Cybersecurity Assessment, how does this compare to the one released by Asper Tracy?
That is an awesome question. And I actually don't know because I haven't seen the assessment from Asper Tracy. I'm going to assume that it is a recent publication. At the time of when we developed the toolkit and held our workshop, once again in April 2025, our healthcare coalitions had not received any guidance from Asper as far as an assessment toolkit or assessment form. So I'm going to have to plead a little bit of ignorance on the exact document that's being questioned.
Nicholas, if you can, if you would be so kind so that we can review it and maybe put the link in the Q&A, and I'll pull it from there so that we can review and provide you with an answer at a later date. And then we have another question from Rachel. Just the recording is going to be sent out, and it'll also be available on the website. And then we have a question from Alex Waterman that can we explain why the HCCs should use this form versus Asper Tracy or CAMP or CAAMP documents?
Why? There's no requirement. So there is no requirement for any healthcare coalition to use this toolkit in any way, shape, or manner. It is offered as a tool to help implement, for a healthcare coalition to help implement a cybersecurity program. Those 4 other agencies called off in rapid succession, I forgot what those were.
Go ahead.
I'm sorry, go ahead with those agencies, Sherry.
Okay, they are Asper Tracy, and then CAMP, CAAMP, in those particular documents.
Okay. So any healthcare coalition free to absolutely engage with Asper Tracy and their resources and or that CAMP acronym.
Mhm.
But once again, Asper, and I don't want to disparage other organizations, so I won't give that comment. I'll just sort of highlight the idea that this particular toolkit, um, amongst that full landscape of cybersecurity resources, CISA, FBI, Asper Tracy, and that CAMP agency cited, all those resources, this particular toolkit has done is attempted to identify those, distill those, and then represent them back to honor or address that intersection of a healthcare coalition, the cybersecurity, and those ASPR cooperative agreements. Within HHS, within ASPR, they also serve many other healthcare and public health agencies, hospitals, healthcare systems, and whatnot. And the advantage to the particular toolkit is it really comes down onto sort of that healthcare coalition perspective. A hospital's cybersecurity program is going to be different than a healthcare coalition's cybersecurity program in that the healthcare coalition is trying to support cybersecurity of all agencies within a jurisdiction versus a hospital sort of looking out for their own interest. So once again, the idea of the toolkit is really focused on that intersection of the healthcare coalition perspective, the cybersecurity resources, and the Asper Tracy cooperative agreement requirements.
Damien, I would just, I don't know if this is an addition or another thought, but when we put this together last April, there were really not a lot of resources. In fact, there were no known resources for healthcare coalitions at that time, and they were sort of rapidly approaching, the deadline for when some of this work was supposed to be done. So we put this together as a best estimate of what might be included in that. So, I mean, if there are other forms available to help healthcare coalitions do this work, of course, look at those, see what are most useful for you, for your particular healthcare coalition. We know every healthcare coalition is different. They have different ways of functioning. They have different members. So, it's really up to you. And at least again, to my understanding, there was no absolute form that had to be submitted. ASPR doesn't require a particular form. So this is just one option for healthcare coalitions. And review the work that we've done, and if it's useful for you, we're glad to have provided you with this assistance.
Okay, I'm a little behind because I just want to pull through the
So I can see
can you
I can
see them?
that
Okay.
I can see them now. Thank you. And
Okay.
so I see a question from Eric, sort of hinting at how do we envision healthcare coalitions and the differences between various types of healthcare coalitions as far as structure, function, purpose, and whatnot. And Eric is asking an awesome question. We, Region 5 for Kids, really originally focused on the 40 healthcare coalitions within our 6 states. And we have a good grasp and concept of how most of those are staffed and operate and their capabilities. Within Region 5 for Kids, we do have some urban healthcare coalitions with a staff of upwards of 12. And we do have a healthcare coalition with a staff of 2 to cover an entire Michigan Peninsula. Wide variability as far as resource, staff, structure, and assets. But I will tell you this, doing the marketing, a more national outreach to healthcare coalitions has been a very eye-opening learning experience in recognizing that even outside of Region 5 for Kids, how states adopt, develop, implement, and spend their hospital preparedness money to stand up healthcare coalitions varies greatly. There's some states where State Department of Health keeps the money and manages a program. There's other states where State Department of Health gives all the money to a hospital association, and a hospital association runs the program. There's some states where every county gets a little bit of money. There's some states where they actually take an approach of using a regional approach, multi-counties within one healthcare coalition, and have maybe 5 or 6, 7 healthcare coalitions throughout the state. Some healthcare coalitions, once again, are managed and run through a public agency, i.e. a state Department of Health or a local public health department. Some are managed through private contracting. And so as mentioned, this particular toolkit, originally written, we knew we had a wide audience. We tried to have it as generic and universal and user-friendly as possible, so that whichever type of healthcare coalition was interested in it could take it and move it forward. So it's universal, it's in the Word format. Anybody can jump in and edit, add, delete, whatever helps out their healthcare coalition, with the idea that this is just sort of hopefully an easy step one in a more robust process at the healthcare coalition.
I think that actually answered or partially answered Alex's question about what funding and the needs assessment directed us to do this in terms of a need, because there was not a lot of guidance. And part of our funding is to help support and work with the HCCs as an extension. But there is no specific funding that speaks to that.
Sherry, can I take a stab at that question as well?
Yep.
And I'm speaking on behalf of Region 5 for Kids and our work to develop pediatric disaster preparedness and response. Over the last couple of years, we have found that healthcare coalitions are a critical partner for us to engage and develop pediatric preparedness. Every time we engage a healthcare coalition, we come away learning much more than we offer the healthcare coalition. Within our 6 states, our 48 healthcare coalitions, we would love to have strong relationships with each of those 48 healthcare coalitions, so that we can assist and learn local conditions, and the healthcare coalitions, in theory, provide us a great venue or intermediary to carry our pediatric message forward to those community partners. So it's a bit of a hand in glove relationship. Ideally, we're supporting healthcare coalitions. Healthcare coalitions are critical to our work, and ideally, we're supporting healthcare coalitions such that we're able to advance our Region 5 for Kids goals as well. And with that, I think we're going to go ahead and begin our closing out.
Actually,
Jerry?
Damien, there are a couple of other questions that I just want to acknowledge from Nicole asked just about HCC's help using this to help mitigate with third-party vendors. And I think that whatever we didn't answer, we'll go ahead and answer in a follow-up. And then Damien and Dr. Ruffing are always available, or anybody at Region 5 for Kids, to have future discussions and answer further questions.
Thank you. And so with that, I'll just circle back to, once again, if Healthcare Coalition is interested in accessing any one of these 4 resources, the full toolkit, a template for an assessment, a template for a support plan, and a template for an exercise plan, all written to address that intersection of healthcare coalitions, cybersecurity, and those ASPR requirements. Available on the Region 5 for Kids website through this QR code. I would also like to sort of announce or market a little bit. On 10 December, there will be a follow-on showcase to address the extended downtime requirements of the ASPR Hospital Preparedness Program Cooperative Agreement. Similar structure, similar toolkit, available for use or not by any healthcare coalition that's interested. And once again, presented in a Word format, so the healthcare coalition can add, edit, delete, change at their convenience. And so that'd be a second showcase on extended downtime requirements of the ASPR Cooperative Agreement. And we are planning a third showcase for a third toolkit to address the patient movement and load balancing requirements out of the current ASPR HPP Cooperative Agreement. This one is a little more challenging to pull all the pieces together for a high quality toolkit. This one will be presented in March. Once again, there's QR codes to, if interested, to register for and sign up for. After this showcase ends, there will be an email sent to all participants in the showcase that will include links to the cybersecurity toolkit and flyers for both of these follow-on showcases. And with that, I turn it over to Dr. Ruffing for any sort of closing comments.
There was one question in the question and answer about, a robot, because the question was, if health systems have robust cybersecurity programs, do we get any information from hospitals or health systems? And my response to that is, I think hospitals and health systems have kind of gone silent in this area, particularly those health systems that have had experiences with this. No one really wants to talk about what goes on. It's really difficult to get any information. Because these events have become so common, I think everybody is starting to experience them in some form. But it is really hard to get this type of information from hospitals or health systems about their cybersecurity practices. They're seen as their corporate business, and there's a lot of liability potentially associated with this. So there isn't a lot. I don't see a lot coming from health systems or hospitals in this area. Obviously, everybody is very interested in this, but they're not sharing a lot of their particular information. So I mean, that's just my response to that. In overall, I just want to thank everybody for participating. We hope that you found this valuable. If you have found this valuable and you're thinking about joining us for the future events, we look forward to having you join us again. And please share, again, if this was worthwhile, share this with your colleagues who are, if people are struggling with putting this work together, have them join and listen to our discussion of the various topics. Thanks so much for joining us today.